Deadlifts. This strength training is dominating gyms. But beneath the hype lies a serious question. Are deadlifts safe if you have spine problem like spinal stenosis or slip disc? Spinal stenosis is a condition where the space in the spinal canal narrows, often due to wear and tear or degenerative changes. And this narrowing can put pressure on the nerves, causing leg pain, tingling, numbness, muscle weakness, especially when standing or walking. And people with spinal stenosis often cannot walk for a long distance without needing to sit down to relieve the symptoms. Again, spinal stenosis is caused by wear and tear in the spine. So the question is, do deadlifts speed up wear and tear in the lumbar spine? Deadlifts itself is a good exercise. It may help protect the spine by strengthening the surrounding muscles and improving posture and movement pattern. But deadlift can be bad, can be a problem if it is done, number one, with poor form, especially if you're rounding the back. And number two, if it is too excessive or extreme loading, too heavy. And the last one, without sufficient recovery in between. Too aggressive. And they can contribute to increased wear and tear in the intervertebral disc, the cushion, and the facet joints. Over time, this may be associated with accelerated degeneration in susceptible individuals. So, in individuals with pre-existing spinal issue, deadlift can be bad. The spine is not as fragile as you think. It functions as both support columns and a shock absorber. It thrives under moderate controlled stress, which help maintain strong bone, strong disc, and strong muscles. In fact, regular loading through activities like walking, lifting, and resistance training stimulate tissue adaptation and resilience. Problem arise when we carry extreme weight regularly. So, what is extreme weights? There is no fixed weight that defines extreme for the spine. It depends on form, strength, and existing conditions. Poor lifting technique, especially bending and twisting the spine under load, greatly increases the risk of spinal injury. Trained individuals may safely lift 2 to 3 times their body weight, while untrained people may be injured lifting very little weight. Pre-existing issues like disc degeneration, spinal stenosis, or slip disc lower the injury threshold. The warning signs include sharp back pain, leg pain, tingling, numbness, and muscle weakness. So if you experience these symptoms, you better stop. To protect your spine, use proper form, do not lift too heavy loads, and strengthen your core. What does the literature say about weightlifting and spinal issues? Number one, strength training enhances spinal stability and muscle control by training the body to better support and protect the spine during heavy lifting. And number two, core strengthening reduces risk of spinal injury by improving stability and movement control. Number three, improper lifting technique can place excessive stress in the lumbar spine, significantly increasing the chance of disc herniation or slip disc. And number four, most spinal injuries in weightlifters occur at L4, L5, and L5S1 segments, often due to poor technique and improper load management. Now, the real question is number one, can extreme weight damage the spine and accelerate the degenerative process? My honest answer is yes. Extreme weight can damage the spine and accelerate the degenerative process. However, it is important to note that there are currently no studies to confirm this. This conclusion is based on my clinical observation and reasoning rather than hard evidence. The second question is, does lifting extreme weight provide additional benefits in enhancing spinal stability compared to lighter weight? Again, this is just my opinion. I believe there is a threshold beyond which increasing weight does not offer further benefit for spinal stability. And pushing beyond that point may increase the risk without delivering proportional gains. But this is my personal opinion. There is no research to clearly support this claim at present. The bottom line, deadlifts don't automatically cause or accelerate lumbar spine degeneration. The real danger lies in how and how much you lift, not the exercise itself. When deadlifts are performed with proper techniques and appropriate loads and adequate recovery, they are generally safe and often beneficial. When performed with poor form or excessive spinal flexion or too heavy, they can contribute to injury or worsen existing degeneration. I hope you understand my points about deadlifts and spinal degeneration. Don't forget to subscribe, like, and share. Thank you so much for watching and see you again next time. Bye-bye.